So, today we're diving into a situation that is, well, incredibly common and incredibly difficult in medicine. What happens when a patient is in real, debilitating pain, but all the tests, all the scans, they come back clean? It's this huge conflict between a person's actual experience and the cold, hard medical data. And it really all boils down to one sentence, taken directly from a patient's chart. This is it. This one sentence says it all. You can just feel the frustration, right? It's this cry for help that shows just how wide the gap can be between feeling sick and actually being seen as sick by the medical system.
So to really get what's going on here, we have to do more than just read the chart. We need to try and understand what this patient's world, her daily reality, is actually like.
Okay, so here's the story. We have a 39-year-old woman, and she's dealing with this chronic, life-altering pain in her left breast. And I mean, this isn't just a little ache. The notes say the pain is so bad she often simply lies in bed daily. Think about that. She even went through a major surgery to have her implants removed, hoping that would be the fix, but nope, the pain is still there. And you can imagine, emotionally, she's at her wit's end, absolutely convinced that something awful like cancer is being missed.
All right, so let's switch gears for a second and look at this from the other side, the clinical perspective. When a doctor is faced with a case like this, they turn to the standard playbook. It's a logical, methodical process that's designed to rule things out one by one. So if you're the provider, your goal is pretty straightforward, at least on paper. First, you have to be methodical. You use the tools and procedures you have to rule out any physical cause inside the breast itself. And second, you have to figure out how to manage this patient's pain, which is very, very real. It's all about a systematic, evidence-based approach.
So right away there's a disconnect. The patient wants an MRI, but the doctor's plan starts with a mammogram. And you might be asking, why is that? Well, there's a clear clinical reason. An up-to-date mammogram is actually a prerequisite before you can even order an MRI in this kind of situation. It's the standard first step, and in her case, she wasn't current on her screening anyway. So the bottom line is, you gotta start here to officially rule out any local problems.
And look, this decision isn't coming out of nowhere. It's backed up by her history. Her mammogram from 2022 did show some benign things, but the official read was no suspicious findings. Then an MRI in 2023 found nothing new, stating there was overall no change from 2021. So from the doctor's point of view, all the existing pictures are saying nothing to see here, everything is stable.
And this is where it gets really tough, right? This is the conversation about ordering yet another MRI. The benefit is obvious. Maybe, just maybe, it'll find something new. But the risks? They're huge. MRIs are so sensitive, they can create a ton of false positives. And that can open up a whole can of worms, leading to more procedures, painful biopsies that might not even be necessary, and of course, a big out-of-pocket cost for her. It's a really careful balancing act. So the standard clinical map seems to be leading to a dead end. But what if we're using the wrong map entirely? Let's pull out a totally different kind of map and see where that one leads.
This idea is all about what are called systemic symptoms. It's a framework you hear a lot about in communities focused on things like breast implant illness. The core theory is that a root cause, say chronic inflammation or the body's reaction to something foreign, doesn't just cause a problem in one spot. Instead, it's like a ripple effect that can trigger a whole web of seemingly unrelated symptoms all over the body.
And when I say web, I mean it's incredibly broad. This perspective looks for patterns everywhere. For the immune system, you might see things like swollen lymph nodes. For the endocrine system, it could show up as crushing fatigue or weird mood changes. And for the nervous system, you'll hear people talk about brain fog, headaches, that kind of thing.
And the map doesn't stop there. It connects things like widespread joint and muscle pain, digestive problems like bloating and discomfort, and even changes to your skin and hair. The whole point of this way of thinking is to stop playing whack-a-mole with individual symptoms and instead ask, could all of these clues be pointing to one single systemic root cause? So we have these two different ways of looking at things, the very focused clinical view and the super broad systemic view. So what happens when we take our patient's documented symptoms and lay them over this new systemic map? Well, this is where things start to click into place. That chronic breast pain she's feeling, on this map, that fits right into the musculoskeletal or nervous system category. The polyarthralgias, that's just a fancy term for the joint pain she reported, that links up with both the musculoskeletal and immune systems. And her myalgias or muscle pain, classic musculoskeletal. Suddenly, these aren't just random isolated problems anymore. They look like they could all be pieces of the same puzzle. So where does this leave our patient? Well, she's basically stuck in the middle, caught between two very different and, in their own ways, very valid ways of trying to understand what's happening to her body.
And this, right here, is the absolute heart of the problem. On one side, you have the objective data, the scans, the tests, the numbers, all of it showing stability, nothing dangerous. But on the other side, you have her reality, a life that has been completely sidelined by real, constant, and debilitating pain.
And I mean, you have to understand, this has been going on for years. It's a long, frustrating road. A benign biopsy back in 2022, then a clear mammogram later that year, an MRI in 2023 that showed nothing new. Even after the huge step of removing her implants in 2024, the pain is still there, and she is still searching for an answer.
So it all comes down to this really big, really difficult question that's right at the heart of modern medicine. When the objective data and a person's lived experience tell two completely different stories, which story do we believe? And maybe more importantly, what do you do about it?